no gold is not enough.
Hello, everyone. I'm Tammy Jesuson, and we are here once again with another Insight interview. In case you've forgotten, Insight.Teens is a career development resource created for those struggling what to decide what career or field they should go into. Today, we'll be interviewing Mrs. Williams about her career. I'd like to thank you so much for being here today.
Oh, sorry, I didn't know it was my turn. Oh, I'm really happy to be here. I'm glad to be here to, give some advice to people that trying to decide on their career
All right.
choices.
Thank you for that. All right. I'd like to begin with my first question, and that is, what is your occupation and what made you decide on that
Okay, so I'm sorry, I don't think I introduced myself. I'm Dr. Helen Williams. I'm a family physician, and I take care of people of all ages. I take care of babies, children, teenagers, young adults, older people. And the main thing I do is really, I strive to help people live well. Um, I like people to continue to live healthy lives, and also like if people have chronic medical problems or have acute illnesses like colds and sore throats and just acute problems, I'm there to help manage those as well. So that's what I do. I'm a family physician. I'm a doctor that takes care of people of all ages.
All right, I'd like to ask a burning question, and that is, what made you decide to become a doctor in the first place? Because I know a lot of people, I mean, especially from where I'm from, it's like, oh, you become a doctor or engineer, but actually going through with that can be a little bit more difficult. So I want to know what encouraged you to pursue that career.
Sure. So I think being a doctor has always been a dream of mine since I was little. As I think as young as I probably was less than 10 years old, I didn't have anybody in my family that was a doctor. My mom was a nurse practitioner, but I think that just my innate personality to always want to help people, serve people, and just, I guess, that compassion that I have for other people, and that willingness to want to just help somebody in need. If someone is crying over there, or somebody needs something over there, I'm drawn to that person. So I've always been a doctor since I was a little. I've always wanted to be a doctor since I was a little girl. I had this big dream that I was going to build my hospital and provide free health care for everybody. So it started since when I was little. I think it's just something that I guess God has put in me to do. I just love to help people. That's why I went into medicine, to be able to serve people, help people, and just fulfill whatever need that they may have.
I think that's the case for a lot of people to go into that field because I feel like you really need to have that desire and that willingness to be kind of selfless and to be willing to help other people. And I think that's also a very admirable quality to have. So thank you for talking about that. Okay,
Oh,
my next question for you is what does your work entail on a day-to-day basis?
on a day-to-day basis, basically, like I said earlier, I am trying to help people stay healthy. So one of the things that I really enjoy doing on a day-to-day basis is really offering recommendations about how people can live healthy. And one of the ways to live healthy is to prevent diseases. So I like to give, encouragement or education about how people can eat healthily, small portions, trying to avoid fried foods, little things that people can do, lifestyle modifications like exercising regularly, at least 5 days out of 7 days a week, 30 minutes each time of doing some kind of physical activity, eating the right kinds of food, avoiding foods that will make you gain a lot of weight, trying to prevent diseases like diabetes, hypertension, low salt diet, stuff like that. So I like my day-to-day basis schedule entails doing a lot of education about preventing diseases. But people have diseases. People have tried to live healthy, but some one way or the other they have chronic medical problems like diabetes or hypertension or lung diseases. So my job on a daily basis is to try to manage those conditions. So in addition to trying to prevent diseases, I also manage diseases, and I try to prevent or reduce complications that can happen from those chronic medical problems. um, I also, I mean, the truth of the matter is on a day-to-day basis, besides doing education and managing chronic medical problems, I also have to deal with the paperwork that goes along with being a doctor, filling out forms and medication refills and attending to patients' calls and concerns and stuff like that. So that's what my day looks like.
All right, thank you for sharing that. And I think that's a great segue into my next question, which is in these times that are quite uncertain, considering that COVID-19 has made a huge impact on this year, how has that affected your work and how does that affect what you do at your job, considering you are a doctor?
Sure. So, I mean, COVID-19 pandemic really was kind of a surprise to many people, but it has impacted me in the way I practice medicine, in the sense that I have to do things electronically now. Like for me right now, I go into work 2 days a week and I work virtually, like I'm communicating with you right now. So this is a virtual visit. I do that 2 days a week, and then the other days, 2 days a week, I go into work. So the mode of delivery has certainly changed, and I think that is even going to continue after the pandemic. In terms of other things, I mean, I have to see patients. I have to see patients virtually in my house. So sometimes I will have to have my children around me. They also don't go to school every day. They go 2 days a week to school. So I have to try to juggle that. It's been somewhat challenging. It's been a journey, and it's been a blessing in disguise, because even though I have to work from home on some days, which is nice to be in the comfort of your home and seeing patients, but it's kind of distracting. But it's been a blessing in disguise, because I've been able to spend more time with my kids, learn more about them, and just be more of an intimate part of their lives. So it's nice. It's been a blessing in disguise also for people out there that, for whatever reason, before the pandemic, maybe it was challenging for them to get into the office to see the doctor, but now they can do it in the comfort of their own home, sometimes in the car. All they have to have is a mobile device like a cell phone, and you just have to have the appropriate apps like a Zoom or whatever app that is affiliated with your insurance, and then you're able to see the doctor that way. So I mean, obviously there's some things that go along with that in terms of patient confidentiality, information and stuff like that. You have to make sure that there isn't a lot of noise around you. So the pandemic, as it has impacted the way we practice medicine, but we are still seeing patients. I'm still doing the same things, striving to help people live healthy, managing medical problems, chronic medical problems, and serving others, doing my job as a doctor.
And I think that's a huge part of how all our lives have really changed, considering there are a lot of give and takes. Like there are setbacks that come to being online, but there are also things that we are able to do through technology that we were not able to do in person.
Certainly.
So I feel like it's definitely changed a lot of things, some for the better, some for the worse, but kind of learning to adapt to that is really important. All right, my next question to you has to do a little bit about your college experience, and that is, what were the highlights of your college experience?
My college experience. So, um, I was born here in the United States, but I grew up in Nigeria, West Africa. So I came here as a teenager. I was 17 when I came here, and I went to a 2-year college. Coming from out of the country, coming to the United States, I wasn't used to the academic, you know, um, used to how schooling was here in the States. So I went to a 2-year college, Truman College to be precise. And I had a good experience there, by the way. So I transitioned to a 4-year college, DePaul University. So I did my remaining 2 years there. So that was where I got my Bachelor of Science in biology. And then, I had a year gap of working before I started medical school. So my college experience wasn't too bad. I didn't live on campus because actually I went to a boarding high school. So I kind of already experienced all that living away from home in high school. So, so college for me was, I didn't live on campus. I was driving, taking the train actually and the bus from home to college. So it was good. It was focused for me. I wasn't distracted. When I came back to the United States at 17, my dream was always to be a doctor. So I was like, what do I need to be a doctor? Oh, you just have to do a degree in biology. Sure. So that's what I went for. So I was very focused. I mean, I had a very high GPA, but that's one side of it. But that's not all you need to get into medical school. So my college experience was good. It was very focused. And I think that if I were to do it again, I probably wouldn't go to I would maybe go to another school where that was more like science inclined. DePaul is more of a business kind of liberal arts college. So you want to go to a college that is in line with whatever you are trying to go into, like in, after college, whatever profession you're trying to get into.
All right, I just have kind of a follow-up question to that. So I've heard from a lot of sources, both on the media and other people, that medical school is a little bit challenging to get through. So I guess what I would ask is, what was your prime motivator, or what kept you focused? What led you to finish through strong, even though it is that difficult to get through?
Sure. I think that once you've established what it is that you want to do, and for some people, it's really easy for them to decide that this is what they want to do. And for some people, it may be difficult. One good rule of thumb is to kind of look at your talents and, like, what is it that you enjoy doing? What do you see yourself doing in the future? Some people may have told you things. And of course, make praying about it. So once you've established that this is what you want to do for the rest of your life, then that is really, that motivation is always going to be there, not letting anything kill that motivation. So for me, even though it was challenging through medical school, I kept my goal in sight and I was focused that was what I was going to do. I mean, I did have some setbacks along the way. And even despite that, I still finished because that was what I believe that I wanted to do, and that was my goal. I wanted to accomplish that goal. So my motivation to finish strong was just because of that passion that I already had, that I already established that was what I wanted to do, and no matter what, I was going to finish. Yeah, I was going to finish, and yeah, and I think just my faith in God, like, deciding what you want to do for the rest of your life, you need to be in touch with your faith, whatever you believe in. If you believe in God, believe that God has created you for a specific reason, then that is the person that you have to be in communication with while you are on the journey to accomplishing your dream. So that was the person that I was in communication with throughout my, my educational journey of being a doctor. So, when I had some trying times along the way, I prayed. I'm like, God, you have to help me through this. And, using the people around you, God will put people around you to support you, to help you, to mentor you. You have to reach out to people around you. You have to seek out mentors And, people have done this before, shadow people, see if you are interested in a particular field, try to shadow someone in that field, go to their places of work and, watch what they do, see if this is truly what you want to do. Yeah, I hope I answered your question. I have more to say, but I don't want to take up all the time, answer that question.
Yeah, and I think one thing that you said that really stood out to me is kind of that passion and drive. Because I feel like a lot of people, there's this aspect of pressure that goes into what people decide to do or what they want to do in the future, whether that's from parents, from peers, or just people around them. And I feel like it's really hard to distinguish that from what we actually want to do. And what ends up taking us to the finish line a lot of times is what we feel in our, what we know we're good at, what we're passionate about. Because if that's not there, then, I mean, I'm not saying this exactly out of personal experience since I don't have a career yet, but I imagine if that's not there, then it's a little bit harder to get through that. So thank you for sharing that.
Yeah,
Oh,
definitely.
all right. My next question for you is, hmm, I know being a doctor can't be that easy, right? Along with helping people and going through all of that, there are some challenges that, of course, come along the way. So I guess my question for you would be, what are the biggest challenges you faced in your career and how have you overcome
Um, Challenges. I would say that there are two ways to answer that question. So my challenges as a student and as a resident, so as a doctor in training, was just really trying to get through everything. I went to DePaul University, which was a school that was not really science. I think it was really science focused. And like I said, if I had to do it over, I probably would go to maybe another school that was more science focused. So I think for me, and this really helped me, actually, this has really helped me in my career in terms of when you decide that you want to go into a career, you want to make sure that you are not just going through just to be the best in your class, to be the top of your class. You really want to go in and you want to go in to try to understand what you're learning. You are going to be a doctor that will be in charge of people's lives. You have people's lives in your hands. Of course, you're not going to save them. God is the one that ultimately saves you, but their lives are literally in your hands because you are the one that is giving them medications. You are the one that is managing their chronic medical problems. You are the one that, in a way, decides if they're going to die. I mean, what you do can kill them, and what you do can save them. So you better make sure that when you are in medical school, that you are truly having an understanding of what you're learning. You're not just going in to be like top of your class. Of course, we have everyone that goes to medical school is competitive in one way or the other. We're all kind of top of our class. So for me, I learned that very quickly, the beginning of medical school, that, you know what, I cannot always be the top of my class. We're all smart. So I focused my attention on trying to have an understanding along the way. Like I wasn't just going in to try to pass my exams and just get really high scores. I really wanted to go in to learn and just learn as much as I can. So when I get out, I am a very confident doctor. So I guess for me, because I felt like I didn't really have a good foundation, and that's because I guess I didn't maybe have the mentorship. I didn't really have people to kind of guide me. I sought those people out along the way. I had to learn my way, learn along the way. So those were the challenges for me, was just trying to just get through, like sometimes I would find myself I would read just to kind of like just get this thing down. And, I mean, like along the way, there were some tests that I had to retake too, not major exams, but just like along the way, I had to, just to be honest with that. So for me, it was kind of challenging, but it actually helped me. It made me become a stronger student. So by the time I got into residency, I was the strongest student. Again, I had that mentality that I'm not trying to be the top of my class. I'm trying to get through this so that I will be very seasoned and very knowledgeable as a doctor at the end of the day. And I will be the best doctor that I can possibly be. So those were the challenges that I had. Some challenges also in medical school. Obviously, as a minority, we are truly minorities. I mean, if you're African American or Hispanic, you are usually the minority in your medical school class. But I went to a medical school. I went to University of Illinois, where they had minority support. We had a minority program that supported minorities, and that was very helpful. I mean, like, we had our own little meetings. We had our own support group. We take, study together, and that really got me through medical school. I mean, I had my friend that went to another school where they were not as supported, and even though it was an Ivy League school, top name, she felt like, gosh, I wish I'd gone to another school because she didn't feel supported there. So that's one of the things. If you are trying to select a graduate school or professional school, you want to make sure that you're going to a place that you know that you'll be supported. You want to talk to people that are already in the program and see what their experiences have been. So my challenges through my medical school educational journey was just, I guess, trying to get through the program, trying to get through, and I made it through, and the experiences that I went through helped me in residency, which is further training after medical school. And so that's that. And then now, as a physician, where I'm no longer a doctor in training, my challenge is really, it's different. I don't have to answer to anybody. I mean, I'm not directly supervised because I'm already a doctor. Once you get your medical license, nobody really can take that from you unless you get into trouble with the law, you do something as a doctor, they can take your license away from you. But it is your license because you've worked so hard for it. But the challenges that I guess I'm facing right now is trying to deal with the ever-changing landscape of medicine. Medicine is always changing in the way we do things. There are always different rules. What I'm doing as a doctor right now is not what I thought I was going to be doing. Some doctors didn't know they had to go through so many paperwork. You have to see so many patients in such a short time. Like, sometimes you have to see a patient that has so many medical problems in, like, you only have 15 minutes to do it. So those things we're not quite, I mean, they kind of went through with us. I mean, that we kind of were informed about that in medical school, but this is reality, experiencing that. So my current challenges as an attending physician now is trying to deal with the ever-changing landscape of medicine, which is always going to change. When you are in a professional school, what they teach you there is fine. I mean, that's what's happening now, but guess what? After you graduate, it may be different. But again, if you have that passion to want to be a doctor or to be whatever you want to be, that passion is going to get you through the different changes. Some doctors have quit just because of how stressful medicine could be. But if you have that passion already in you, that this is what you want to do and this is what you enjoy doing, you can't see yourself doing anything else, it's going to help you get through it. So that's one challenge. And then the other challenge being an attending physician right now is just trying to balance work, family life. I'm a mother of 2 young children, and I want to be involved in their lives. I want to be involved in their schooling. If they have events, I want to be able to attend. So try to balance that, being a doctor and being a mother, being a wife. It's quite challenging, but I'm getting through it with God's help.
Wow. So I think I'm definitely thinking about everything you said. I think it's really interesting. Being a doctor, it's kind of different in my mind than a lot of other fields because of how people oriented it is, and how, like you mentioned before, a lot of times as a doctor you are responsible for the livelihoods of people. So that kind of changes the game a little bit, makes it so that there's a lot more pressure on you to do well. It's not just doing your own job, but your job is affecting the lives of others. So I think, um, as you said, it definitely affects your work. And I think what you said about being actually striving to learn the things in medical school instead of just getting through it. I think that's applicable to a lot of things that we do. I know in my school experience, it's really easy to just study for the test, just to get the test done, go on to the
Yeah,
next, and just get through
sure.
it. But at the end of the day, what we end up learning and what we end up remembering, if we don't focus on the learning aspect of our education, that part is kind of lost. And then
Yeah.
it's kind of like, well, why did I do it in the first place? It's like,
Sure, sure, sure. Those things are really to help you be able to apply it. You're getting the theory, and then you have to now utilize the theoretical knowledge. You have to apply it, be able to apply it to day-to-day applicate. I mean, things. So it's you're learning all these things in school because that's not really what you're going to use. It's how you're going to get that knowledge, how you're going to utilize the knowledge that you've learned in school to solve problems, to problem solve.
yeah, I think problem solving is just a huge part. Like, school is school, of course. School helps us a lot, but in the real
Sure.
world, it's not just here's a textbook, you're going to have a test next week. It's more of like here's a problem that you need to solve
To
that's critical.
solve.
Yeah,
Yes, and applying all that information that you have got is in your head, is in your brain, and using that information to to solve the problem at hand.
thank you so much for talking about your experiences. And I'd like to close out the interview today with one last question, and that is, what is your advice for any aspiring doctor?
Sure. Well, basically, it's a summary of everything that I've said. Basically, you want to establish that this is really what you want to do, because once you have started the journey of wanting to be a doctor or being a doctor, it's a lifelong commitment. So my advice is you want to take this as something that you are going to do to impact lives. And no matter how trying or difficult it is, you have to stay strong, hang in there. You have to have a way of distressing, which there's always going to be stress around us. So definitely involve yourself in other things that will get you away from medicine. Medicine will always be there. You don't want to keep working all day long. You want to take time out to do other things that you enjoy. Could be going to church. It could be doing a hobby. Taking on another, you know, interest of yours. It could be interior decorating. It could be cooking. It could be teaching in a Sunday school. It could be just doing something outside of medicine. You want to do that. And then you also want to take time out each time, take time to for vacation. You got to take time out to relax. And and you want to enjoy what you're doing, just be good at what you're doing. Do things in an excellent way. If you are advancing and flourishing in the profession that you have chosen, that will motivate you to keep going and keep going, you know, striving to get to the top. Each profession has its hierarchy of promotion, like you can always go up in your career. Okay, you don't just be a doctor and just be there. You can grow even in being a doctor. So take time out. First of all, establish that this is what you want to do. Take time out to do other things, and you just do your work with passion and excellence, perseverance, never giving up. And the other thing is, one last thing is always have a moment of reflection, because sometimes, yes, you may be on a certain path. It doesn't mean that God doesn't have another plan for you. God may be telling you, okay, now you've been on this path this time. I want to maybe take you to another path. So just always kind of being in touch with your creator, whatever it is that you feel like that God has called you to do. Always have a moment of reflecting on it and just thinking, okay, just talking to God, okay, I'm at this moment in my career. Do you want me to continue to do this aspect, or is there something you want me to do differently? Always be in constant communication with God about what the next step is in your career. Okay, that's all that I have.
All right. Wow. Thank you so much for being here today. I've definitely learned a lot about being a doctor and all of the things concerning that. And I really value everything you said today. I hope everyone watching has too. I want to thank you once again for being here. and we'd love to have you back at another time.
Sure. It's been my pleasure. Thank you so much, everyone, for listening. All right.
Thank you. Bye.
Bye. Bye-bye now.
All right. I'd like to thank everyone for tuning in today. We really appreciate the support, and we hope these interviews have proved valuable in your lives. Make sure to like and drop a comment down below of what you think, and don't forget to follow us at insight.teams. See you next time.